What's an example of a patient that has experienced a reproductive injustice?
So a woman who came to my clinic, I'm in Orlando, and she came from the Tampa area. And I do have a lot of women of color in my clinic, but this woman was a Caucasian woman who, at the time she finally got hold of me, she was 36 weeks pregnant. She had liver cancer that was being treated by an oncology team in Tampa. But between herself and the oncology team, no one could find this woman prenatal care in her area. She went through an entire pregnancy seeking prenatal care. She was seen at one clinic and waited for 4 hours and was turned away, and no one would take her. She finally made it to Orlando, where one of the emergency room doctors sent her to me because they know the work that we do. One of our tenets is you do not get turned away. This woman, who was under the care and treatment for her liver cancer, was 36 weeks pregnant and had not had a prenatal visit for the entire pregnancy. No one would touch her. Now, again, I'm a midwife. I know my scope. I try to stay in my lane. But unless you can get a person started in care and triage that person, she has no access point. This is what I mean when I talk about the system is broken. So we essentially took her in knowing that she wasn't even eligible for midwifery care in order to get her started, in order to create a chart that we could then refer to the high-risk clinic so they would accept her. Because you can't just up and walk into a high-risk clinic and ask for an appointment. You have to be referred to a high-risk perinatology and maternal fetal medicine clinic. So when you think about these convoluted hoops and barriers, when we go to quickly blame the women, we have to be very careful. This is not a woman who wasn't seeking care or who didn't care about her baby, which is often the charge that is put against these women. This woman had been trying for an entire pregnancy to find someone to take her. Now, worse yet, when we did take her that day and we got her started, we drew her labs, we got her ready for an ultrasound, because without an ultrasound, you can't get an appointment at a maternal fetal medicine clinic either. You have to prove viability, right? We did the ultrasound, and guess what? She was carrying breech. So if she hadn't found us, and if we hadn't had an opportunity to say, well, we'll take you anyway, if we hadn't have found our collaborating partners to refer her to once we did our due diligence and got her ready for them, so to speak, this would have been a disaster walking into somebody's emergency room. This woman left her children in Tampa so she could get to Orlando to get an appointment with a midwife who already knew she couldn't keep her. This is just one example of the crazy hoops and circles that we've had to go through to figure out how do you break down and circumvent and bypass a system that is already broken in order to provide care to people who are in desperate need. So I can also add to this, and this is not to cast any aspersions on any group or any hospital or any practice, but the fact that she ended up with me was at my office was because the local people know that I won't say no to anyone. It's not because I'm trying to do heroic, crazy midwifery. It's because if I say no, they literally are going to be in the street pregnant until they bust into somebody's emergency room pushing a baby. So this is an example, and this is just one of many. Hers is one of the most egregious because the woman was already under the care of physicians who seemingly had no power to help her get the correct care for her pregnancy. She ended up with the baby being able to be turned and was delivered vaginally, and everything was fine. That child was healthy, so was she. But think about her psychological state. Think about her emotional state. Think about the disruption of her family and her life and all of the confusion, judgment, blame, drama that went with that pregnancy. And absolutely consider whether that impacted her or her baby's outcome or not. I think it's really a great example of just how broken and how complicated we have made things in the United States for women, especially around maternity care and reproductive health care.
The system failed this patient at multiple levels. How does our system fail to take responsibility for patients like her?
I think because we have a system that is running from a perspective of, it's a business. I think also that we've got, the other piece, which is where the individual providers have to be protective of their work, their education, their time, their practice, their lifestyle, their family. They are in a real pickle because they have a lot at stake as well. The hospital, the risk management teams have, I'm sure, their hands full trying to figure out how to cover their practices, their hospitals, and their doctors. But we've also got to consider that, we want to say that there is access points and that people have chosen to not access them. And that's not the truth. Okay, so you're absolutely right. This goes across all of the areas from ancillary right through to risk management. Every department has a part to play in the fact that this system still stands. When we talk about we provide, grant support or foundation support to, safety net hospitals or to, county hospitals, that sounds good on paper, but is it actually true? I could speak from my own experience. As a provider, I am able to use Florida Medicaid, accept Florida Medicaid for seeing patients, except for, as a provider, I often have trouble getting paid by Florida Medicaid for the patients that I do see. It's also a bureaucratic nightmare trying to get through to different managed care and different insurance companies and their specific and individual idiosyncrasies that they keep secret until, somebody finally will give it up and let you know, oh no, you're supposed to put this number in this box if you want to get paid. So these pieces also play a part that have physicians and providers thinking about, never mind, I won't put myself through that or my staff through that. I'm just not going to accept that. So yes, provision is made. For example, when you're low income, you may apply for Florida Medicaid, for example. That doesn't mean you'll find a physician who takes it. So policy-wise, we could say, yes, we've covered that. There's a way for people who are low income to get prenatal care or to cover their reproductive health needs. Oh yeah, but actually part 2, part 3, and part 4, that's not in place, but we've addressed it. You see, so this is, again, I'm not trying to be judgmental or blame systems. I'm just trying to point out what I see as the current system and why I think it's broken and where the gaps are. If we don't follow it through all the way, we are putting in place barriers that are not going to be resolved. They're not going to be fixed because there isn't any real addressing of those actual barriers because there's not an acknowledgement of those barriers.